because it has shown, the mask has shown to be helpful in terms of preventing especially respiratory transmission of respiratory diseases, especially if you consider yourself and your practitioners before and all those kind of ailments. So I would want to urge all South Africans that it is in our hands now to make those decisions, as also advised by our health advisors. So please, it mustn't be as if now it means because the regulation has changed, everybody must just throw away. We wouldn't like to interpret it that way. The regulations which we published still remain regulations for control virus, which covers any kind of such viruses. And we subsequently specifically mentioned COVID in the amendment. So we will be continuing to amend those regulations to make sure that they are also user-friendly in terms of other pandemics, more than just when the regulations were drafted in 2017 were meant to. So we're going to continue. We're going to look at all those submissions and now look at a more long term, but also in preparation, because as we have said, there is no certainty as to the COVID get a variant which can complicate and escape all the immunity of what we have. There's no certainty, but Prof. Mlisana is more qualified than me to. I'm just a generalist who has not practiced for 30 years, and she's the specialist in this area. So if there are further questions, they can. But in terms of regulations, yes, for that question, we are going to continue looking at amendment, because there must always be regulations to deal with notifiable medical conditions. The question as to whether schools and old age homes and other settings can still demand people to only be allowed with masks. There are many premises now, no mask, no entry. So the question, I think the question relates to that. Our response to that would be that that's really, if you run a facility, whatever that facility, you have the right to determine regulations. Whether you run a shop, whether you run a restaurant, whether you run a hotel, you can have your own regulations for that facility, which you are comfortable with, and your clients are happy with those regulations. So if the managers of a school or old age home want to keep the mask, if the parents' body, what is it called? The school governing body of a school, for instance, just as an example, meet and decide that for the purpose of their school, they are happy with their children wearing masks in the school. That's the school policy, but it's not the government policy. So I think we must just make that distinction. So that will apply to all public places. It will be up to the members of such bodies and also regulators and owners of such facilities to make those decisions without government having any say. Thank you.
Thank you, DG. Thank you, Dr. Phaahla. You see, I was wearing it as per the law. If I wear it next time, it will be self-precaution, which is still in effect. Commemoration of July, I know of no details, except that we stay alert in case those crazy ones are contemplating repeating what they refer as their impact. On the BRICS, I think the DERCO or Minister place, and there's the detail of where are we. DERCO is better place, but I wouldn't say that. I imagine that all material terms.
Irene, I'll take the House journalist, Heidi. for you. Do we know how many vaccines we still have and how many are set to expire because they're just not being used? Is this a concern for you? Next question. It's breaking news all over now that we have one case of monkeypox and everyone is concerned because this is all deja vu because this is what happened with COVID. We had our first case of COVID and everyone said, don't panic, relax, and almost 3 years later, it caused a lot of devastation. So perhaps if you could just provide some clarity there. Another question might be, if they are in a position where they feel that you should wear a mask, it's going to cause a lot of confusion. So maybe if you could just, clarify that specific point, because some people are already out today with no mask because they feel the regulation is lifted, we don't have to be in a...
Irene?
Thank you. I have two questions now from from UFM to Minister Gungubele. Did Cabinet discuss the 3% pay hike for public office bearers, in particular the public outrage over the decision? And is there a single minister who expressed discomfort with regard to the pay hike? The second question, has the Cabinet discussed the criminal actions against President Cyril and more so when the President is increasingly becoming a story and one that overshadows his work as the head of state? Those are the two questions that I think have been
I think we generally take 2 rounds, and I'm hoping this is the last round, unless there are others.
Yes, there is.
Okay, so should we take, are there many?
Just one.
Okay, let's take that.
Additional question from Simen. Did Cabinet discuss the high cost of living and increasing prices of basic essentials such as food and petrol, and does government consider it to be a crisis?
Okay, thank you. Okay. We've got health and we also have cabinet.
Thank you very much. In terms of the vaccine stocks, I'm afraid to go into hard figures because they also change. But what we can say is that we still have substantial numbers. There has been some good response from some of the contracted suppliers like the COVAX, where we were due to receive quite a sizable consignment of vaccines which we had ordered before, but which are mainly Pfizer. But due to the slow uptake, there's been further negotiations, and COVAX have agreed to waive that commitment. So in terms of that, I know that we will save just around 1 future delivery, also to try and negotiate that that also should be waived. But we estimate currently that vaccine